The first condition that we treat is when the sciatic nerve, its root is pinched by a bulging disc between the fifth lumbar vertebra and the sacrum. And when that gets pinched, you can develop sciatica. Another condition is between the glutes when the muscles get pinched. That's another area where the sciatic nerve can get pinched. And so that's the second area where we can focus on, and slightly different techniques. What we try to do initially is put the pressure off the disc and make sure that the sciatic nerve gets a decrease in pressure, and when patients are in the vest, it actually helps to take the pressure off the spine and relax the spine, and also put hydration back into the disc, and therefore the disc comes back into its place, therefore taking pressure off the spinal cord. And that's one way that we can help the sciatica. If we have a patient, say, coming in with lower back pain going down to the left or right leg, and it is sciatica that's involved, we usually try to take the pressure off the nerve. However, say it's on the left side, on the chair we would pull on the right, the opposite direction, therefore taking the pressure off the nerve, and therefore having a relief of pressure, hopefully for the patient during that technique. And on the table it would be the opposite of what we do on the chair, and that in turn relieves pressure off the nerve also. And those are slightly various different techniques that we also use in treatment of sciatica.
Okay, so we're going to be treating the lumbar area here, and we're going to use this device called a Pro Adjuster. It has these two prongs on there that are pressure sensitive, and what we're going to do is find each vertebrae in the lower back and check how each one is moving. And then we're also going to check the sacral area to see how each of those bones are moving. And then once we get a little reading here, we're going to replace that device with an adjustment head to move those bones. And basically, when we move that bone, it's just going to put some pressure on that bone and cause some vibration, causing that bone to move. Next, we're going to work with some of the muscles surrounding the lower back, utilizing this device. And we're going to work the sciatic pattern going down the back and some muscles in the lower back here. And now we're going to run this down her leg. So we've just completed a treatment for the lower back and also sciatic nerve going down the left leg.
I'm Taryn. I'm a physical therapist assistant. We're working here with a patient who has sciatica. Right now we're working on stretching out the back of her leg, mainly her hamstring here. And what we're doing is we're going to hold for 20 seconds. You can do it 3 times. When you have pain down your leg, a lot of time it's coming from your back or from tight muscles, so we really have to focus on stretching out all the muscles, especially after going through all the machines. After we get this back, it's a good stretch. We at 20. Then you want to make sure to give it a rest so the muscle gets a break, and then we'll switch to the other side. You want to feel a good pull behind the leg. If you start to get any shooting pain, you just want to bring it down a little bit so you're still getting a pull but no pain. With sciatica, you want to be very careful not to do anything on your own. You want to make sure you get your doctor's approval before you go ahead and start doing any stretches, because you want to make sure you're not pulling any muscles that don't need to be pulled on.